It is such a sometimes frustrating invalidation because this is what women deal with, that often their very real frustrations in life are reduced down to this idea that it's because you are hormonal or you are, about to get your period. And that's what I think a lot of women have experienced at some point. A guy or a friend being like, are you getting your period?
Well, medicine historically has had a terrible reputation of invalidating women's experience with healthcare. There's just a culture that women should endure and not complain about it.
I feel like there's so much stigma surrounding women's periods. For so many years, we were told that you don't talk about it, you shouldn't talk about it, it's gross. We were invalidated in our feelings when we feel emotional or a bit upset or, like whenever anything goes wrong around that time. Laura, you've spoken about it. Someone goes, oh, are you on your period?
To be fair, I mean, and I know this and I recognize this in myself. Before I get my period every month, like I do have a couple of days where I'm either feeling a little bit sad or a bit clingy or doomy gloomy, and Matt he will point it out. And often he is correct, but I don't need it pointed out for me. Thank you very much.
Well, exactly. But so many women experience symptoms around their period and before their period, premenstrual, so differently. Like some people get no symptoms, some people get severe symptoms, and it plays havoc with not only your body, but mentally. Because you're like, I don't understand what's happening. I don't usually react this way. But if you've had these feelings, and I'm ashamed a little bit to say I'd never even heard of this before, but you might have a reason for feeling that way because there's something called PMDD or Premenstrual Dysphoric Disorder that I've only recently started to hear some people talk about. And I thought, oh my God, there'd be so many women that are experiencing PMDD that didn't know what it was or anything about it. So we wanted to do an episode on it today, but not just with Laura and myself, but with somebody who knows absolutely what's up. Dr. Izzy Smith, who we have had on the podcast before. We did an episode with Dr. Izzy on PCOS. She's been an endocrinologist working for the better part of 10 years. We thought, who better to come on and talk to today? So Dr. Izzy Smith, welcome.
Thank you for having me back.
I feel like this conversation around PMDD, though, it's been picking up a bit of steam. And the reason why I say that is because recently Bridget Huswaith, who we've had on the podcast before, she has written a book all around endometriosis. But she recently did a post where she was very emotional and she was talking about this PMDD diagnosis. We also had Angie Kent on the podcast quite a while ago and she spoke about her experience with it as well. But from a medical specialist, like what is PMDD and what does that really stand for?
Just firstly, Laura, I think you're spot on about we're hearing more about women's health. Endometriosis is so much better understood and known by the general population. Polycystic ovarian syndrome, the menstrual cycle, even menopause we're talking about more. Perimenopause,
though, it's been a really big talking point, not just in the media, but like across pop culture. Mamma Mia has spoken about perimenopause so much recently. And I think the pendulum is definitely shifting in how we have these conversations.
Well, medicine historically has had a terrible reputation of invalidating women's experience with healthcare. I always mention, a hysterectomy is called a hysterectomy because it was thought, women who probably had a severe mental illness such as schizophrenia, it must have been their uterus that made them hysterical, so they would have a hysterectomy to improve their mental health.
To stop them
Izzy,
from being
you actually taught me that years ago, and I tell everyone that. That's like my fact of when I want to drop a fact and impress on a dinner party.
Trivia.
That's what I say, yeah.
That's right. Your feminist trivia.
Well, I hope I am quoted, Britt. But to get back to what PMDD is, so premenstrual dysphoric disorder, I'm going to just call it PMDD from now, essentially is really severe premenstrual syndrome. So as Laura said, you feel pretty crappy a couple of days before your period. Your mood might be a little bit irritable, a little bit sad, a bit doom and gloom. Hopefully you can still function in your day-to-day life. You can go to work. Your relationships don't completely fall apart. In saying that, I've had many fights with people. Not many. I'm definitely more sensitive as well before my period. But it doesn't have a major impact on my ability to function. If those symptoms get much more severe and, there's specific criteria to diagnose this. It's in the DSM, which is the kind of mental health criteria. You need to have around 5 of these and they are having really severe kind of mental health symptoms. So anxious, depressed, irritable, then sometimes some physical symptoms, severe fatigue, people can't get out of bed, muscle aches and pains, joint pains. And it has to be in the week before your period and then the symptoms resolve after the period. As you can see, some of those symptoms could sound like depression, could be anxiety. And some of the more physical symptoms can be similar to endometriosis or menstrual migraines. So it is quite important someone gets the correct diagnosis. And sometimes it's a diagnosis of exclusion, making sure there aren't those other conditions. And then if someone meets those criteria and those symptoms really do get better after the period, that is what, we think is most usually PMDD.
How long after your period are you talking? Because I'm just doing the math in my head. That means the week before, the week of your period, and then what, like a week after? That's 3 weeks of the month that these women are experiencing that.
People's symptoms generally should be better within a couple of days within their period, and that's related to the underlying cause of PMDD, which interestingly though, they're still not completely sure on the science of what causes PMS and what causes PMDD. It's not actually abnormal hormones. So someone often comes to me and says, I want you to test my hormones because I feel really bad before my period. And it's actually a response to normal hormones that is causing the symptoms. And some people get really severe symptoms and some people are totally fine, as you said. But usually it's the progesterone, which only happens in your menstrual cycle after you've ovulated. And as the progesterone gets higher, the PMS symptoms or PMDD symptoms start to occur, and then the hormones rapidly drop. So the main two theories are a kind of metabolite of progesterone, so one of our main female hormones, interacting with our neurotransmitters in a kind of abnormal way, and also the rapid change in hormones just before the period. And some people's PMDD might be almost straight after they've ovulated, so they're really, really sensitive to progesterone. Versus some people's PMD might just be a few days before their period, and maybe it's more the rapid decline in hormones that they're more sensitive to. And just in general, talking about hormones, there's so much individual variability of how we're impacted by our hormones, and not just our reproductive hormones. I have some people who see me who are so hypothyroid, the markers are almost off the charts. And they're still doing their job and they're like, oh, I'm a little bit tired, but not too bad. And some people might have just slightly low thyroid hormones but feel rubbish. Or people with that PTSD, we know if they're exposed to adrenaline or stress hormones, they might have a very different response to someone that doesn't have PTSD. So we're so individual with our hormones and not just our reproductive hormones. And that's why, PMS and PMDD impacts everyone differently.
When you say progesterone, you're still talking about the reaction that someone has is still a reaction to what would be considered a normal amount of progesterone in the system. Just some people's reactions are way more adverse, which may be what classifies or someone can be diagnosed with PMDD, rather than it being an issue where there's too much progesterone or not enough progesterone to cause this sort of reaction.
Exactly, Laura. It's a clinical diagnosis. So that means I'm not doing blood tests to diagnose it. I might do blood tests to exclude other conditions or refer them to a gynecologist to screen for endometriosis. But once everything else is ruled out, it's a clinical diagnosis based on the history. There's a little bit of some very small studies maybe suggesting naturally higher levels of progesterone could be associated with worse PMS, but the data's not strong and it's not a problem with your hormones.
It's so interesting. So I made the joke at the start, right? Which Matt, and he knows, he sees it in me. He's got a good gauge for when I'm about to get my period, probably because he's like mentally tracking it as well. But he sees the difference. And sometimes I will be way more reactive to things that I wouldn't be had I not be, having my period in 2 days. Usually for me, it's like 2 days before and I am in a hole.
What about, are you more sensitive to criticism?
100%.
That's one of the big diagnostic criteria.
Yeah.
I will second that.
Criticism, but genuinely I feel as though I am depressed for a couple of days beforehand.
Do you track your cycle, Laura?
No, I like to wing it. Also, we do the pull-out method, so I am not the right person to have that. We really
Let's
are
not
winging
go
it.
there.
If you're using withdrawal method of contraception, I would definitely recommend tracking your cycle, not just for PMDD.
Guys, I want a third child, so we're hoping. Anyway.
Yeah, but you can't trick Matt into doing it.
Okay, he knows what he's doing. The guy's well aware how babies are made. He made 2 of them. But what I wanted to say is, off the back of that, is it is such a sometimes frustrating invalidation, because this is what women deal with, that often their very real frustrations in life are reduced down to this idea that it's because you are hormonal or you are, about to get your period. And that's what I think a lot of women have experienced at some point. A guy or a friend being like, are you getting your period? And I can only imagine though, for people who have PMDD, who have been struggling with these sort of highs and lows in the volatility around how they feel, that this would be a very frustrating thing, because it comes with the invalidation from other people around you that when you're struggling with something, they're like, oh, you're just getting a period.
But Izzy, how do you differentiate between someone that's just experiencing shitty feelings and somebody that's experiencing shitty feelings? Because if there's no blood test and nothing that's actually physiologically being tracked, how do you as the doctor say, oh, okay, you're worse than Sally?
Well, I think we'll go back to what Laura says and then answer that question, because in some ways saying, you are being hormonal, there is validity to that. We tick off those criteria like increased sensitivity to criticism, labile moods. These are real symptoms that people are experiencing due to hormonal changes. Your boyfriend or husband saying, oh, you're just being hormonal, of course, is completely invalidating how you're feeling. But there is, truth to our mood, how we feel can be impacted by our hormones. And we need to respect that and give it the validation it deserves rather than brush someone off and not make them, feel listened to. But it is legitimate. And that's why I think we really are, tracking how can we know what's normal, what's a little bit blue and what's really bad. And I often think about this because I track my cycle very tightly. I know when I'm going to ovulate. I know, I'm like, oh, I've got my ovulation, breasts are a bit bigger.
So do
I've
I.
got this. Yeah.
Do you know, actually I'm sorry I'm interrupting you there, but I can, now that I'm off the pill, because I was on the pill for my whole life, now that I'm off the pill, I can tell you the exact second that I feel like I'm ovulating. Literally, I go, oh, there it is. I'll open I won't know it's that day, and I'll open my tracker and it's exactly.
And it can be really empowering just understanding our body. Like, why do we have this type of discharge sometimes and other types of discharge? Why am I a little bit, sorry, Demeter, I'm using medical language, why am I a little bit puffy at different times of the month? So one, tracking your cycle is just critical, irrespective of if you're using the pull-out method for contraception. I think
Which is not contraception,
irrespective of whether you're being irresponsible. We understand.
I would say there's actually, I'm not going to talk about my personal life. That is completely unprofessional.
No, please do, Izzy.
I just had a thought come into my head and then thankfully another thought. So not talking about my sex life on a podcast. No. So we need to track our cycle. And I always find it funny because I don't think I have PMDD, but I definitely get PMS. And sometimes in that few days before I'm in my period, I need to consciously tell myself, do not give the thoughts you're having or the feelings you're having very much emphasis right now. Be aware of them. Notice that you're feeling this way, but know that you will feel better in a week or two. And then sometimes it'll be a week after my period and I feel really sad for no reason. I'm like, I would have put this down to PMS if it was 2 weeks ago.
Totally.
So that's where you need to track your cycle over, multiple menstrual cycles. There's lots of different apps, the Flow app. I actually use the Femi app, which is the female running company I work for. The Garmin app's not too bad. And then there are the specific criteria. If you also think you could have PMDD, I really like a website called the International Association for PMDD. And they've actually got a little, you can go on and it says like, do you think you could have PMDD? You can go on, you can answer questions. That's a really good resource. There's the Jean Hales website. If they're having an impact on your function is really what we talk about with mental illness. This is a kind of combination of a physical mental illness condition, but it does fall under a mental illness. It's in the DSM. We all get anxious sometimes. Mm-hmm. We all have a low mood sometimes. It's when it's consistent, prolonged, interfering with our functionality when we call it a disorder.
So PMDD does in fact fall under a mental health condition.
Yes, it does fall into the mental health condition, but I'm an endocrinologist and PMDD is a funny one because it falls into different specialties. You can have an endocrinologist involved because, we're good at hormones, we're good at prescribing hormonal treatments or turning off hormones. You can have a gynecologist involved because for some people, they end up having their ovaries removed because this condition is making them stay in bed for 2 weeks of the month. They can't have a job, their relationships, especially it seems as women get older, the PMD can get worse and they can't function. And that might sound really extreme. And sorry, I'm going a little bit off topic, but
it's interesting.
I'm always asked, what can you do for PMDD? I don't want to take an antidepressant. I don't want any hormonal treatment. And I talk about, let's track your cycle, let's journal. There's a few supplements that don't have much evidence, but if you have severe PMDD, I would recommend the best evidence-based treatment, which is fluoxetine or other antidepressants. And people often, they don't want to take that medication, but then it's really impacting their day-to-day life and function. So it's hard as a doctor, I'm torn because, the best evidence-based treatment I can offer you is, turning off ovulation, is an antidepressant. And so if it is so severe, I think we need to validate that this is a really serious condition for some people And supplements are great, but it's not always going to cut it, as is journaling, as is sleep, as is cutting out alcohol, as is tracking symptoms. So for PMDD, it's not just bad PMS. For some people, it's really disabling and quite full-on treatments are needed. And that's why, gynecologists involved, psychiatrists are involved, sometimes even a neurologist to make sure it's not a menstrual, migraine. For some people, it is a really severe condition.
I have two questions. Firstly, how common is it, I guess? Because I think everyone can identify with aspects of this that you're talking about. And I know you say once it's gotten to a point where it's really impacting people's life, but what does that look like in terms of the amount of women who might suffer from it?
So different statistics, you look at studies and, look at the population and see how many people have PMDD. It quotes around 2 to 5% of the population. So that's quite a lot. Probably a lot of people don't know they have it. They have a week or two of the month, especially 1 week, where they just feel absolutely terrible. Also, it can be associated with other mental health disorders. So if you have underlying depression, it can then be exacerbated in that week before the period. But around 2 to 5% is what we quote. It's really interesting with PMS because depending on where the study is done, really influences the percentage of the population that identify with having PMS. So maybe to some degree there are some cultural aspects. In some countries it's as low as 10% and some countries as high as 70-80%.
Wow.
But around 20 to 30, around 20% of the population is what is quoted generally.
When you say that it can be controlled by either antidepressants or turning off ovulation, can it be controlled by going on birth control and just staying on the active pill so that you're not actually going through, ovulating?
Yes, that is, one of the treatments. The most evidence-based treatment generally is an antidepressant, and that can be just in the luteal phase, so from between ovulation to the period. Fluoxetine is what's generally used because it stays in the body for a long time. So if you do just take it for 2 weeks a month, you don't have a rapid drop of the antidepressant, so you don't have that withdrawal syndrome. And that's effective in around 70% of people. The pill also, generally the evidence shows for people who take the pill, they feel better in the premenstrual part, but their mood in the other parts of the menstrual cycle is not as good. Isn't really evidence that one pill is better than the other. I often now prescribe a pill with the body's natural estrogen, like a 17-beta estradiol, as there's some data showing that might have better impacts for mood. We do know the pill can have a negative impact on mood, especially when prescribed in adolescence. And when I give advice as well, it's always about the individual in front of you. You're taking in there, and that's why I never say medication is all good or bad. It's all about the context. Would I give chemotherapy to everyone to prevent cancer? Of course I wouldn't. For someone who's got cancer, of course it's great. The pill, is it appropriate for everyone? Of course it's not. But for some people it is effective. And yeah, it can be used for PMDD.
So PMDD, is that something that will, if it's going to affect you later in life, it'll affect you from your very first menstrual cycle, or is it too highly related to a period of your life? And I guess what I mean by that is people that suffer PMDD, do they suffer it from when they start their period, or do you heavily link it to mental health issues so that maybe when they've never had it before, then they're in their mid-20s or their 30s and they start to experience extreme symptoms because of other things going on in their life?
Usually the first one. So people will generally say they've always had challenging, not very good symptoms before their periods, but we do seem to find it gets worse as people get older. Sometimes people actually find with PMDD their mood was quite good in pregnancy, and then after pregnancy, once they get their menstrual cycles back, the symptoms come back. And yeah, it does seem to be whether it's coming towards the perimenopause time, it is worse. But yeah, it's not just like I've now got a period of depression and now I feel worse between my period. It's often, someone's always had this kind of not very good response to changing hormones and the progesterone, the other kind of theories of what cause PMDD.
As a woman working in the medical industry, and especially in the field in which you work in, there is a lot of conversation that's happened over the last couple of years around medical misogyny and around even for women who go and maybe present to the doctor with all the signs of PMDD might be highly dismissed. How prevalent do you think that is in your experience?
Yeah, this is such a tough question for me because it kind of drags at my heartstrings because in some ways medicine has been my entire life. I started medical school when I was 18. I have grown up in hospitals and treating patients. Also, my first experience that made me want to be a doctor was I had kidney failure as a teenager, and I went to my GP, not my regular GP, and she told me, oh, you're just a bit puffy because you've started the pill. I went on and ran a half marathon in kidney failure, and I come from a non-medical family. I'd been told the doctor says it's probably nothing, you're fine. And I had kidney failure and I knew there was something wrong with my body. But I think when you're non-medical, when a doctor says, oh, it's probably nothing, you're just like, well, that's what the doctor says.
Totally, and you're young, so you believe that they're the adults, they're the doctors, they're the smart people.
Yeah, and you don't really know how to advocate for yourself. And then I had some really amazing experiences with the healthcare system, and it taught me how the doctor I want to be and the doctor I don't want to be. I now work in quite a style. I work in private practice. I don't work in the hospital anymore, but I have seen, terrible communication, and it's all about the communication. Generally, medicine has amazing treatments. That's probably why I love it. It's like science is magic. That is not magic, it's science. Yeah. And I love that. It's so exciting. And so that's why I get so sad when people have these really negative experiences with their healthcare system and it's due to poor communication. I will say in some ways it is the system that doesn't support good healthcare all the time. Also, I think there's a really big expectations on GPs to be experts in everything, which, they just can't be. And you come in and you've got 15 minutes with someone you've never met. So I always say have a regular GP, build up that rapport and the relationship to have good healthcare experiences. But I do have people that come to me and have had really, not very good experiences and just not being validated. And even if I might not necessarily agree when a patient says, I did this and I think it gave me this condition, I'm not going to invalidate their experience. I'm not going to say, that's not right at all, because I just don't know. We can never really prove something, what someone's experience was. So that's a really chitty-chatty way of me saying it's real, it's disappointing, we need to do better. And part of why I do like a rise in some of the kind of alternate health medical misinformation is because it's making doctors have to be better, because patients are having such negative experiences with their healthcare system that they are going and seeing someone probably giving them some pretty expensive non-evidence-based treatments, because unfortunately that is better than some of the healthcare they have access to.
Yeah, or even just the idea of what we were sold for so long as women, just being told that periods are supposed to be painful. That's normal. Periods are painful. For some people, they're really painful. And now all the conversations that have come out around endometriosis, and so many people who have been missed. It's not until they're in their late 30s that they're being diagnosed with something, or mid-30s because they've gone through fertility or whatever it is.
Conceive. I talk about, when I do public speaking, there is a culture of women enduring. Young girls enduring really heavy menstrual bleeding because they're having, cycles where they're not ovulating yet. Then people having to suffer with PMS, PMDD, painful periods, then pregnancy. You're supposed to go to work when you feel, Laura, you would know this, you're not allowed to tell anyone because it would be shameful to have a miscarriage and share publicly. So, I just think it's ridiculous that, don't say anything until 12 weeks. And then you give birth and it's a badge of honor to, not
be working straight away.
To be working straight away.
To do it with no drugs and not complain. And
there's just a culture that women should endure and not complain about it. And I think that's, a lot of women's health in the healthcare system. And I hope that is improving.
Is there a higher correlation of people with PMDD that have PCOS, endometriosis, other conditions?
So in terms of the association, there's definitely a genetic association. We know if you have a family member who has PMDD, you're more likely to have it. There is actually also an association with childhood trauma. And I find that really interesting because this is really a problem of your neurotransmitters, because your hormones are okay. It's the response to the hormones, an abnormal neurotransmitter response. So when our young brains are developing and in trauma responses and responding to stress, there's a strong association, and, the Queensland government website has some education on that.
So let's just break this down a bit, because there'll be a lot of people at home that won't understand neurotransmitters and hormone fluctuations. No, yeah. I'm one of the people that would like to know more, because I think the first thing that we say, even to each other as women, is, someone says, oh, I'm feeling really shitty. They're like, you probably have your period. You're like, yeah. But a lot of people don't understand what that actually means in your body. So what actually happens with the hormone fluctuations and the neurotransmitters?
Let's do a 60-second menstrual cycle tutorial.
Yeah.
So when you have your period, your hormones are actually at the lowest. Then you start making estrogen, and you've got your little follicles in the ovary developing and making estrogen. Then one lucky follicle is the chosen one that ends up being ovulated. After you ovulate, your estrogen levels go back down. And then progesterone comes into the picture. Progesterone is the main hormone in the second part of the cycle. So after you ovulate, that prepares the lining of the uterus for a implantation of an embryo. If there isn't an embryo, so the egg wasn't fertilized, the progesterone, goes up, and then it will start to drop. And then when the progesterone drops, the lining of the uterus, the endometrium falls away, and that's the period, and the hormone levels are low and the cycle starts again. What I said about neurotransmitters, back to the underlying kind of cause of PMDD, the main theory is a metabolite of progesterone called allopregnanolone interacts with GABA receptor. So GABA is one of the receptors in our brain, and it's like an inhibitory receptor. So you've kind of got excitatory and inhibitory receptors in the brain, and that has like an abnormal response when it binds. That's the main theory. Also, we know our reproductive hormones interact with, serotonin, dopamine, and, other hormones that are involved in our mood.
When you're saying that childhood trauma can have a link, you're saying because the neurotransmitters when you're a child are sort of trained not to fire off the same way?
I don't think I can, say that there's any hard evidence or research, but we do know there is an association with childhood trauma and your risk of PMDD. Of course, that doesn't mean everyone who has childhood trauma would get PMDD, or people that have had no childhood trauma, of course, still get PMDD. It's an association. I think that's something really important to understand. When you look at risk factors for a condition, doesn't mean that's necessarily going to happen. I have every protective factor to not get asthma. I was born vaginally on a farm. I went to childcare. The house definitely wasn't overly hygienic. I had pets. I had siblings. I get asthma, eczema, dermatitis, allergies. I get all of these things, even though I had every protective factor. Some people could have had none of them and don't get any of them.
Yeah.
So, risks, cause, risk association. It's not as simple as like cause and effect, but that is a risk factor. We do know there is an association with other mental illnesses. So depression, you are more likely to get PMDD. And then there's sometimes a little bit of overlap between endometriosis and PMDD as well.
You mentioned that the associated factors that might indicate someone could be more likely to get PMDD aren't necessarily something that's like, there's not the research on it. There's not like there's, an unequivocal research study where you go, okay, here it is, this is what it looks like. But what is the research in terms of how much attention PMDD gets as a topic for research, or even women's issues in general? I feel like it's just such an area that is under-resourced in terms of what we actually do know about it. So much of it is like subjective, or it is, what's another word for it? It's
hearsay, theories, hypothesized.
I guess, yeah, based on like the information that's coming in rather than it being from a broader study.
Now, this is almost a big question where you could talk about the complexities of medical research and cause effect. And I think sometimes in the community, we think finding a solution is as simple as just, we'll do a study or, put some money towards it. Look at conditions like dementia, all cancers in general, neurodegenerative conditions. They have so much money and research put into them. We still don't really completely understand the cause of motor neuron disease. So it's not always as simple as there hasn't been enough funding. In saying that, women's health has definitely been underfunded, and especially conditions that aren't fatal. So, there's lots of money in breast cancer. Endometriosis is only finally starting to get funding. And that's not to say breast cancer isn't important, but research costs so much money. And that's why researchers are constantly trying to get grants. It's really difficult. And to find something which isn't like this condition and mental illness and mood disorders in general, we still don't have a really good understanding of the pathophysiology of depression, how the antidepressant medications work. We know they can increase serotonin, but has there been much data to show it's low serotonin that causes depression? Not really. So I would say we do need more research into the understanding of this condition. There is pretty good data that's related to this allopregnanolone. They've done studies where you can give a medication called a 5-alpha reductase inhibitor, which is, if anyone knows, it's the same medication as like finasteride that men take to, prevent hair loss or for prostate medication growth. That actually stops the conversion from progesterone to that metabolite, and that has a beneficial effect for symptoms for people in PMDD. Okay. So I think there is pretty good evidence that it is related to this metabolite. But of course, we need, better treatments. I think the fact that our only treatments are an antidepressant and turning off ovulation, really it would be better to have a more targeted treatment that had less side effects.
How does PMDD affect relationships and friendships and people with their work relationships?
I think the best person to ask would be someone who has the condition, in honesty. But what I hear my patients say to me, they'll come in crying saying, I'm yelling at my kids or my husband and I'm not being myself, and I don't want to be this person. And they often have quite a lot of kind of guilt and sadness of part of this month I'm not myself, and then I go back to feeling great. The other side, for some people, it's really physical symptoms, severe fatigue, can't get out of bed, joint pain, muscle aches. So it will be different for different individuals.
I don't think I experience extreme PMS symptoms at all. Like I think I've been really good, but I'm just trying to think about it now. I'll get on the phone to my partner Ben sometimes and I'll be like, I'm so sad. I'm so upset. And he's like, what's wrong, babe? And I'm like, I don't know. And
Feelings
at the time,
of hopelessness.
100%. And I'm like, I don't want to get out. I don't want to get up today. I don't know what it is. And then I'm like, oh my God, maybe I have depression. And then I'm like, hang on a minute. Open my app and I'm like, I'm about to get my period.
This is often misdiagnosed as depression. And although some of the treatments might be similar, it's really important to understand the diagnosis. And that's, again, why the tracking your cycle is so critical for anyone who thinks they could have PMDD.
What is the benchmark for criteria? So how do you actually, what do you work through as a list to say, okay, tick, tick, tick?
So you need to have 5 criteria, and they're first 3 ones are kind of mood related. So it's irritability, and it's kind of our feelings of hopelessness and the feeling sensitive to criticism. Then other symptoms, often more physical symptoms, but you need to have 5 of those symptoms. If anyone is listening, like I said, that website, you can go through if you think you have it. It's also just to do with the timing. Do the symptoms improve after the period?
And that's it. And then once that's been...
And other conditions have been excluded.
Right, okay.
When a woman goes into perimenopause and menopause, and obviously hormones are completely out of whack, does PMDD get better or worse?
So after menopause, it will get better. In perimenopause, the symptoms can often get worse.
Yeah, because it's just trying to work out what the hell's going on.
Perimenopause, just perimeni, is that what we call it?
Perimeni.
Perimeni, oh my God.
You can call it perimenopause.
Next time I see a patient, I'll be like, I think you have the perimeni.
Laura from Life Uncut said
She's
so.
like, what? I need a manicure?
A panny.
Yeah, a pedicure.
Perimedi, oh my goodness. So perimenopause is the highest mental health risk time for a woman in her life. So Australian data from 2021 showed women between 45 to 49 had the highest suicide risk for completed suicide. And I think that's a difficult time for women in their life generally. Often they have aging parents, adolescent children, often high stress periods of their career. But then, perimenopause with crazy hormonal fluctuations, hot flashes, physical and emotional changes adds to that. So when we talked about kind of medical gaslighting, perimenopause is one that women really are dismissed. They get their thyroid function checked. They are told they're not in menopause and, that's it. I
always misdiagnosed as depression.
Yeah, and I love treating perimenopause because people come in often feeling so sad and crap and crying, and I put them on HRT and they come back being like, thank you so much, it's really easy for me. That's a little bit off topic, but yes, PMDD often does get worse in perimenopause, but after menopause it should improve completely.
Izzy, what would you say to someone who's listening to this but they have dealt with, basically they've just dealt with the highs and lows of their menstrual cycle, and for them it is completely normal, not something that they love, not something that they enjoy dealing with, but they are used to having this period where every couple of weeks they feel absolutely fucking down and rotten, and then everything goes back to normal. What would you say to people who think that that's a normal reaction to ovulation?
I would first, again, I really sound like a broken record, track your cycle and see the pattern in behaviour. Then there's lots of things that we can do that are good for our mental health, that are just generally good for our mental health. So regular exercise, not just at that time, but in general has good data for improving mental health and PMS symptoms. Then, avoiding not too much alcohol and things like journaling, all of those positive things we can do for our mental health. Specific to PMS, we do know some supplements do have a little bit of benefit. So magnesium has a little bit of data. Vitamin B6 has data for improving PMS symptoms, also has some data for, morning sickness. It can cause neurotoxicity if taken too high. So B6 neurotoxicity, tingling in fingers and toes. And it's very easy to get too much from being like, oh, but vitamin B6 is good, I'll take 3 times the amount. You can get toxicity quite easily.
Yeah.
Then omega-3s also have a little bit of evidence. Then there is another herbal supplement like what Vertex also. So there are some supplements that we can do. And if someone finds they have this difficult month, it's not, their mood is impacted, but they're functioning okay. They don't feel like it's impacting their quality of life. Maybe someone a little bit like me who says, I'm aware of this. I don't give that time too much emphasis. I'm gentle with myself in that time. I'm a very enthusiastic runner, but I will back off at that time because I know my body just can't perform at high intensities in that week before my period. So I might adjust some of my lifestyle factors around my menstrual cycle with kindness. And, that is what works for me. I don't have PMDD. I have PMS. For people, if it is really catastrophic in that they're having 2 weeks of a month that they can't function, I would say that definitely deserves treatment. And of course, you start with the lower grade things. And if they're not helping, then maybe it is time to consider something like, fluoxetine for 2 weeks a month, seeing and making sure it's not something else as well. So who is the best person to see with PMDD is a little bit hard because it's kind of managed by lots of different people, but always
as you said,
a GP with an interest in women's health would be your first stop. And the thing is, don't go to a bulk billing clinic to a doctor you've never seen before. And sometimes I say, GPs often have special interests. If it's a doctor who wanted to do plastics but decided they didn't want to be a plastic surgeon, but they're going to be a GP and specialise in minor surgeries, skin cancer removals, probably not the best person to talk to about your periods.
Yeah.
So look on the GP website. Often it will say, this doctor has special interests in XYZ. I think is a really good place to start.
We're going to put all those links that Izzy did mention throughout the episode. We'll put them in the show notes so that you can go and have a look if you think this could affect you or someone you know. And at the end of the day, this affects so many people. If you have a friend or a family member that you think this could be affecting, please send to them. Show your boyfriend, show your partner, because it's really important for the men to understand.
I really like the trend of, I think I like the trend, unless it could be used against them, but the partner having the menstrual cycle tracking up in their phone as well. I could see it could be used for you're just being difficult because you're about to get your period. It could be maybe a little controlling, but maybe in some relationships. I can see Laura raising her eyebrows at me.
No, because I think it depends on how your partner approaches. I mean, a big part of you, if you guys came to the live show, it was one of my stories was me getting really angry and mad about something and him being like, you are absolutely getting your period. And I was like, don't you fucking gaslight me. And then I stood up and I had my period. The thing is he knows and he does it with such kindness. He's not using it as a weapon to invalidate me. But often I will act in a way that is absolutely not congruent with the person I am normally.
And that's what my patients come into me sometimes saying and being sad about because they're not themselves 1 week of the month.
Yeah.
But I think that's why men should listen to this episode, because I think a lot of men don't understand what a period is and what happens to a woman's body that is out of our control. It's not us just feeling and pretending to be emotional and hysterical. There's physiological changes that we can't control. And I think the more men that understand that, the more understanding and caring they'll be in a relationship.
10 million %. And I do some public speaking now, and I've almost said, I'm not going to do corporate public speaking. I'm not going to come to a law firm and only talk to the women. The men can sit and listen about fertility, periods, PMS, because it just seems pretty, old-fashioned that this stuff should only be women's business because, 50% of the population are women.
Absolutely. And how do you support your partners when that's what they're going through and you don't have any understanding? Izzy, thank you so much for coming, being part of the podcast again, and for sharing all of your knowledge around this. For anybody who wants to find you or who wants to know more, where can they find you?
So they can have a look at my Instagram. I think I have some posts on PMDD. If not, I probably should do one.
We'll whack one up.
You can have one after this.
At Dr Izzy Smith. I also look after patients with PMDD at private practice, at a few places around Sydney as well. But, really my Instagram is where I like to give people some information that might hopefully be useful.
Thanks so much for coming, being part.
My absolute pleasure.